So you didn't mention about seeing the private part. You didn't mention about chaperone as well. You have
I mentioned about private part, but I didn't mention chaperone.
chaperone, yes. Yeah. Okay. So we will talk about all those things. All right. And again, what we need to do about the you did ask about partner. You can ask about the when you are taking sexual history. Do say that what is chemistry? How's your chemistry relationship with you? By any chance, do you have any other partner? If patient say yes, I have partner. So you are ruling out psychological. Do you have the same problem with every partner? Or with only, because that is sometimes you some patient have erectile dysfunction with a specific partner as well. So this is what you will ask about. And urinary symptom hematuria, you would ask about relationship, you ask about after that. When you come to the medical problem, the most important thing is the maftosa. The most important thing what we need to do in the maftosa is diabetes, high blood pressure, heart condition, cholesterol problem, any medication related to the mood. Screening mood is important. And then you would ask about smoking and alcohol. So the positive finding could be anywhere. So examination wise, I would like to check your weight and height, BMI, your blood pressure. In the presence of chaperone, I would like to see your private part. And when you explain about erectile dysfunction, you will explain that often caused by poor flow to the private part, penis. It has a lot of causes, as you mentioned, like it could be related to stress, anxiety, or it could be related to any medications if the patient have, and smoking, like you mentioned, that try to correlate with that. And before that, you will explain eyes, take their ideas. Did you mention idea, expectation, concern?
Yes, I did.
And relationship, all those things. When come to the management part, guys, you always need to ask all the causes. So what are the causes of erectile dysfunction? Guys, write down in the chat box. And I'll tell you one question for every cause. Hormonal cause. What have you noticed any decrease in hair around your private area? Or decrease in hair in your body? That is hormonal cause. And anatomical causes, any change in the shape of penis, any change, any trauma out there, any trauma in your back. Think about trauma on the penis, trauma on the back, or private part, use that word. Okay, when you come to the management, the most important thing is that if patient is taking nitroglycerin, the top thing, whenever you will be doing the management, guys, I'm going to tell you one most important thing when you are doing the management. I'm going to tell you, if you follow those steps with the management, you will tell the most important thing first, stopping that medication or getting review that medication like I had done. After that, giving that medication. So you say that as you're not taking nitroglycerin, or I will review your medication and I will tell you when, because the patient need that, his life is affecting. In UK, you can get Viagra, sildenafil out over the counter. You just need to fill in the form because they are affecting their life. You would tell them sildenafil. You will give them sildenafil. Even if they are taking nitroglycerin, you have to tell them advice before 48 hours and after 48 hours, don't take it. Because this is very important problem. You won't say that I will not give you medication. No, you have to give it. You have to give it. You will be scored on that. But be safe. Because this is such a problem that can ruin relationships, that can give mental health problems. So you have to offer couple therapy, talking therapy, if the patient is going through that problem. Because there is a psychological cause. If you're not treating the psychological cause, you might not be considered safe doctor. Understand? So when you're managing it, the top thing is after stopping medication, giving medication. Which medication? It's sildenafil. Guys, when I was preparing for my PLAB a few years ago, I used to make a flashcard of every management. So if the patient is going to have this problem, these 4 points, I would say, even when I'm practicing now, when I'm sending someone home, I write 4 points, 4 headings, and your score of management is 4. If you tell 4 points, if you tell 4 points out of that, you will get good score. If you get 4 points, you will get good score, right? If you get 4 points, you will get good score. What 4 points you need to ask? What 4 points you need to ask? or tell. So you will make your checklist, priority list. Most important thing which examiner want to listen. Most important thing what examiner want to listen, and what the patient asking for. If you are not giving importance to the patient concerns and not telling all of your important points in 2.5 minutes, definitely you will not be scored on. You will not be scored on, right? So these are the important things you need to do. So what is the most important point you would say here? I will review your medication. Number one, that might be possible. And the other thing, yes, well done. Excellent. This is what I need, guys. Thank you, Yamin. Trust me, in most of my exam stations, I was getting 4, 4, 4, 3, 4, 4, 4, 3. Because I used to say only 4 points, and I used to ask, reassure, okay, will you do that? Happy, well done, brilliant. So this is what I want, Yamin, well done. Stop medication, give sildenafil, sport, red flags, well done. So this is what you need to do in your, don't go for long 2.5 minutes is more than enough to do any of the management. This is how you need to practice. Convert all your managements in 4 points, guys, if you want to score high. If you want to pass 16 out of 16, 15 out of 16, all of your management of the scenarios should be 4 points. Most urgent one, most important one, reading material, safety netted, leave plan, that's it, safe doctor. And every scenario have one or more important point, like driving, DVLA, partner notification program, or that point might happen. So let's do this scenario again. Yamin, you need to come here. And